And we have to realize how powerful this effect is. Within minutes of eating anything, our digestive system is so efficient that molecules of that mouthful of food you just chewed up and swallowed, within minutes, the molecules of those foods are flowing through every cell in your body where your DNA lies unfolded. And the food molecules wash through the cells and they wash over your DNA molecules and they play your DNA like a piano. And they turn genes on, they turn genes off. They induce enzymes, they shut enzymes down. Every meal brings in not only nutrients, it brings in information. Our food changes us on a genetic molecular level. And you don't need to be a geneticist to understand that the genes that are to be turned on by this steak with all the oxidized cholesterol, reactive aldehydes, B5GC, endotoxin, carcinogens, AGEs, the pesticide herbs, the genes that are going to be turned on by this panoply of disrupting molecules who we know turn on genes that promote aging and inflammation and autoimmune disease and cancer. Those genes going to be turned on by this steak are a totally, completely different set of genes that are going to be turned on by this salad that washes the cells filled with a mixture of phytonutrients that are antioxidants. They quench free radicals. They stabilize membranes. They promote tissue repair. They give the chemical message to the tissues, shh, calm down. It's just rice and beans and greens and fruits and veggies. Relax. Does not need to big inflammatory response as these molecules wash through. Your genes may load the gun, but your diet and your lifestyle pulls the trigger. You may have a genetic propensity in your family for diabetes or high blood pressure, but whether that disease actually manifests largely, not completely, but largely depends on the food you are flushing through your tissues meal after meal, day after day, year after year. Here's a graphic example of how powerfully food can change the nature of our tissues. This on the left-hand panel here, this is the genetic readout of a man with early stage prostate cancer. And all these red dashes here, these are genes called oncogenes. Onco means cancer. They they promote the growth of cancer. They put out enzymes, et cetera, that help the cancer tissue grow more aggressively. Well, this man went on a whole food plant-based diet and for 6 solid months just ran healthy salads and vegetable soups and stir-fried Asian curries and Mexican bean chilies and all this wonderful plant-based meals through his prostate gland week after week for 6 solid months. They then did another biopsy. Same man, same prostate, same genes. And look at the difference. Look how many of these previously active oncogenes have now been silenced, have now been turned off and are no longer promoting cancer growth. What a powerful tool, how we can, and the patient really can reach into their very cells and change the genetic machinery in their tissues to be a more health-promoting variety of genes. How can we withhold this information from our patients? What a powerful tool. Every meal makes a difference. You know, your body is never not looking. You're no fooling your liver, no fooling your arteries. They know what you ate. And you can see every cell in your body knows what you eat. Shakespeare says, to thine own self be true. Dr. Klaper says, to thine own cells be true, to thy own tissues be true. Every meal changes us in one of 2 ways. It changes us either directly, epigenetically, like new 5GC turns on inflammation, but also the food we eat, as I showed, changes the microbes that live in our gut, and they change us because their byproducts are molecules like serotonin and norepinephrine and dopamine. And these molecules get into our bloodstream, into our nervous system, change our moods and our perception. Food is so powerful. We can't just use it for entertaining our tongues. We need to create a healthy body with every meal. And I tell the young med students, look, if you practice medicine just focused on diagnosis and treatment, and you're totally oblivious to what might be causing these diseases, as I was for the first 35 plus years of my medical career, then it reduces you to the plight of the blind men and the elephant. And you probably ran into the old Indian fable, a group of blind men come across an elephant. Each grabs a different part. One grabs the tail, says the elephant's like a rope. One grabs the trunk, the elephant's like a snake. One grabs the leg, the elephant's like a tree trunk. They all have hold of the same elephant, but none of them has the faintest clue what a real, live, whole, living elephant really, really looks like and what it really is. Well, that's the same predicament the physician puts themselves in, who does not take the patient's diet into account. And especially the specialists are in their cubicles trying to reason out what's happening with these various diseases. The cardiologist sees the clogged arteries. The internist sees the high blood pressure. The physiatrist sees the sore joints. The endocrinologist sees the type 2 diabetes. The rheumatologist sees the lupus. The dermatologist sees the psoriasis. The neurologist sees the dementia. The gastroenterologist sees the colitis and the Crohn's. The general surgeon sees the diverticulitis and the cancer. And they're puzzled. They're hoping that someone gives them the clue to understand all these, quote, different diseases. But they said, gee, they all have something in common. They all involve inflammation. They all involve free radicals and oxidative stress in the tissues. What could be causing these same mechanisms to show up in all these, quote, different diseases? It makes me want to go to each of them, give them a big hug, and whisper in their ear, doctor, do you think just maybe that what you're looking at is the effect of all these disruptive toxic molecules from the standard diet flushing through their tissues meal after meal, month after month, year after year? Might that be? I mean, never before in history, for 20 million years, we were plant-eating hominids. We have the same digestive system, basically, that our gorilla and bonobo cousins have. And they're up in the trees eating leaves and fruit, And when we eat a whole food plant-based diet, our body hums right along with it. It's when we eat the food of the mountain lion, and pretend we're flesh-eating apes and a bunch of processed foods, the white bread and the cola drinks, then we set off all these disruptive processes. So I tell the young med students, I wish someone had told me when I was a student, listen, when you open the door to go into the exam room, it's never just you and the patient. It's always you, the patient, and the patient's daily diet for the past 10 or 20 years. It's what they're flushing through their arteries with every meal. That's the invisible sculptor that's chipping away at the inside of their artery walls, the beta cells in their pancreas producing insulin, et cetera. We can't neglect the patient's diet. The food effects over time equal the health effects. And the really good news that I was whispering about the fast food diet as a cause of these diseases into the specialist's ear. The good news that I would yell loudly and clearly is the good news is you really want to heal these patients, then get them on a diet made of whole plant foods. It is stunning, the improvements we get to see, all of us who practice a whole food, plant-based lifestyle medicine. Have many patients, just like Emily, one of Dr. Furman's patients, who I know very well. Emily used to look like this. She was on 2 medications for high blood pressure, so on 30 units of insulin, went on a whole food plant-based diet, took a walk every day. 11 months later, this Emily turned into this Emily. Normal blood pressure, normal blood sugar, off her medications. She no longer has hypertension, no longer has type 2 diabetes. What greater gift, I asked the students, could you want for your patients than to help them achieve this level of health? I mean, why are you going into medicine? Isn't this the apex, the epitome of really helping your patients achieve glowing health? And I kind of hinted this early on, but what I'm telling young med students, incorporate this into your healing strategy with every patient. Look for places where you can reverse disease. These are largely these are reversible diseases. I wish someone in med school said, instead of just chasing the insulin, the blood sugar numbers of your type 2 diabetics, most of them are, how about help them get rid of diabetes altogether? Let's open up their insulin receptors. I'll show you how to do that in a minute. your patient with the angina, the clogged arteries, the chest pain when they walk, and instead of sending them to the cardiologist and send them right to the surgeon, how'd you like to melt away those plaques from the inside? It's reversible disease. I wish somebody had told me that. Now, granted, back in the 70s when I was in med school, we didn't really know much of that, but we know it now. And the young students need to incorporate this very powerful concept into their approach to every patient. It's a thing, disease reversal. There's even an international journal devoted to disease reversal, the international IJDRP. And this is a thing that every young graduating med student needs to know about. Every health professional needs to look for places they can help their patient reverse these diseases so they can get on living their lives as healthy human beings, not professional medical patients.